Welcome to the Business Spotlight. My name is Jada Walker. I am your host for today's conversation, and my guest today is Pravin Shrestha. He is the founder, CEO, and Chief Scientific Officer of Unique Biosciences. We'll be talking today about his business, journey to business ownership, challenges, best practices, and take a peek at what it's really like to build and operate a business. So Pravin, I'm so sorry. Wow. My brain is not working this morning, as you know already. Goodness. Pravin, welcome to the show, and thank you so much for being here today. I would love for you to give us a little bit of your background of who you are and tell us a little bit about your business as well.
Okay, thank you so much for having me here. Actually, like my name is Pravin Malla Shrestha. Yeah, it's a full name. And then I'm originally from like Nepal, and then I did my PhD from Max Planck Institute in Germany, and then moved to United States in 2010. And then initially I started a postdoc in UMass Amherst, and then I was there for 3.5 years. And then after that, I moved to UC Berkeley as a project scientist, and then again worked for 3.5 years there. By the time when I ended my academic career there, like I thought, like, okay, so why not I use my normal basic science background into applied field. That's how I
Yeah.
was motivated to go to industries. So and then
Yeah.
I started my industrial career in 2019, and then oh no, actually in 2017 I worked in San Francisco for 2 years, and then came to Austin in 2019. Like at the like time like 2020, the COVID-19 hit.
Hmm.
So
Yeah.
unfortunately, our company was in the at the time, like when I joined my company, that company was in very low time, and then it was almost shut down,
Oh,
and
wow.
with myself and few of the board of directors at that company, like we started revive that company, like we started COVID-19 testing. We got revenue, all those kind of things. But unfortunately, in 2024 that company was sold out. And then by the time I realized, there are two options for me. Like either I go to another company, or like I start my own company. I thought like, okay,
Yeah.
why not give, why should I work for others? Like, why not create some opportunities for people, and
Yeah.
have them onboarded. That's how I feel like that way. And then myself and two of my colleagues, we decided to start a company. That's how Unique Biosciences was started in 2019, end of 2024, I think. So, and then one of the things we do in our company, main goal was to utilize the salivary diagnostics. You know, Saliva is a good source of sample. You have every analyte you can think of that is
Yeah.
available in blood. So and then it's non-invasive. You can take out saliva anywhere. Like it's not like blood where you have to use a syringe or anything. Yeah.
Yeah.
And so that's how we started our company, in 2020, end of 2024, and then we targeted at the beginning to the dental panels, for example. We have already a unique period signature panel. That's a
Yeah.
periodontal pathogen panels. We quantify and detect 5 major pathogens that leads to periodontal disease. And then
Yeah.
what we do is like we supply that kit to dentists, and dentist gets back sample to us, like we analyze and report it back. Yeah.
Oh, cool.
So not only that, like we have also probiotics. That's a dental probiotics,
Yeah,
oral.
I kind of read your website a little bit and I was like, I didn't know that was a thing. Like, I didn't know you could have dental probiotics and
Yeah, yes,
prebiotics. Like,
exactly.
that's really like, I was just like, wow, because I know you can have it for your gut, of course, but like for your
Exactly.
teeth, like, I was just
Exactly.
like, what?
Yeah, exactly. We wanted to offer like as much as natural things, So there are
Yeah.
so many chemicals you can use, use the range your mouth. But with that one is like you kill good bacteria and bad bacteria both. But
Yeah.
you have a good bacteria, supply your good bacteria in the mouth, So it's more natural and then like, a long-term solution for your oral health. That's how we are doing. Like we have two products, one oral probiotics, another is gut probiotics, that's also there. So in summary, like, I mean, you might be asking how we are unique from others, yeah? So how we are different from others. So the thing is like we offer a complete kind of package, like from the sample collection, saliva sample collection to reporting of those pathogens number or like report creation and delivery of report to treatment recommendations. We AI-based treatment recommendation. The problem with the dentist is like you report dentist with five pathogens. What next then? Yeah. So
Mm-hmm.
that's the thing. Like, and then we have like AI-based treatment guidelines. We offer that also to the dentist. Yeah. That's how
Okay.
we are doing, like,
That's really cool. And it's funny because even like there, I know a lot of people, they don't even like to go to the dentist. And I'm like, you need to go to the dentist, okay?
Exactly.
Like you're
That's very
gonna lose your
important.
teeth.
Exactly. That's very important. Like, there are so many articles now, like, so your
Yeah.
mouth is linked with like oral hygiene is linked with systemic diseases. You can think anything you can think of, like cardiovascular disease. You have like diabetes, like so many things, like Alzheimer,
Yeah.
like So
Like I didn't even know. So I whenever I was pregnant, I didn't know that I could like easily get gum disease or like that my teeth could fall out. And I was like, what? So I was like, yeah, let me make sure I take care of my teeth because like that's the main thing that people look at whenever they look at you is like your mouth or just your whole face anyways. But your mouth, I'm like, at least I do. I look at people's mouths. I don't know why.
yeah, and
I'm like,
another
I just want someone
important
to be like, oh,
yes. Another important thing is like, like when you go to the dentist, like, what they do is like they do X-ray, yeah. First thing they
yeah,
do is X-ray, and then another thing they do is like probing depth measurement, like, So
yeah.
that means like, they put some probes like in your gums, like, and then see the
Mhm.
depth, how much separation is there between your gum and then teeth, yeah. So by the time, like when you have something in your, they see something in your X-ray or probing there, that's too late for you to
Yeah.
manage that oral hygiene. Like, so so what we do offer is like we have three P's, like predictive, preventive, and personalized treatment. Like, so how it works is like when you go to dentist for normal scheduled visit to dentist, like what we offer when you go test with our test panel. Let's say like you have first scenario is you have a very good number of those bacteria, what we are testing, or those bacteria pathogens are not there in your saliva. That's good. Like you don't have to do anything. Yeah, you can
Mhm.
simply keep your hygiene as you are doing now. But let's say like you have certain bacteria which are very, very prone to periodontal disease are in high number.
Mhm.
So what you can do is like, okay, that means like you'll have some periodontal disease in 2 to 5 years. You might be having periodontal disease very soon. So what you can do is a prediction. So that's the prediction part, and then you can like treat your patients based on those numbers. Yeah.
Cool.
So, and then
Wow.
like if you have already the those five key pathogens in your saliva, then what you can do is like you can prevent, like prevent further deterioration, like so you treat. And right now, I mean, until now what is happening is you are just like treating symptoms, not the main
The
culprit.
root problem. Yeah.
Yeah, yeah. So we wanted to treat root cause, like not the symptoms, like that's how our
Yeah.
testing panel works, like so one problem is like it's very, very difficult for dentists and other people to educate, like, education is most important, like, because the dentists who are like, who want to use our panel, because it's
Yeah.
not like, first thing is it's not like insurance covered by insurance. Yeah, that's the most important thing. Like, people wants to have it covered by insurance. The problem with that one is like, they don't think about like, future, like if they have already the periodontal disease and then they have a problem in their root, they have to do root canal or like crown, implementation of crown, all those kind of things.
Or
But
even like the stuff with like bone loss in your
yes,
jaw. Like
exactly.
I didn't even know that was a thing. My brother actually has bone loss in his jaw,
Exactly.
and we're like, how is that? I was like, how is that even possible? Like I'm just like, how do you even fix that? I mean, he kind of has gotten a little bit fixed, I think. But
Yeah.
I was just like, that's a lot to deal with. Like, I don't understand.
Yeah, that's the I mean that's the root cause. I mean, main problem with that thing is like it's irreversible. Yeah, so either you have to
Yeah.
dental implant or all kind of things, like and then at the final end, like insurance are not paying 100%. So if they pay
Mm-mm.
like 40%, 50%, still you have to pay a
And it's
lot
still
of
like you have to
money
fork out.
every
Yeah.
time.
And it
So
still like is a lot of money sometimes. And it's like, where in the heck is the insurance supposed to kick in? But
exactly,
it's like it did kick in. It's just that it still was a lot. And it's so
exactly,
crazy.
exactly. That's true. And then like the test what we offer is not so pricey. Like it's very what we wanted to do is like because if you ask me like whether like there are other companies offering similar kind of tests, like yes, my answer is yes, but those are very expensive and those are not complete. Like
Mm.
we do want to do a complete kind of package. We provide a complete package, not like other companies who I mean provide you like certain tests, but not the complete package. Some companies are doing like next gen sequencing. Like they are offering like 20, 25 different bacterial quantification, like
Hmm.
detection, but that doesn't make any sense. Like more the bacteria you detect, and you don't know like what kind of treatment you wanted to do. Like, but
Right.
our kind of thing is more precise, and then like we wanted to I mean quantify and detect main culprit behind the periodontal pathogen, periodontal disease, like so that's why we say like signature pathogens, like so if you
So
detect these five pathogens, you have a periodontal disease. That's how our testing panel works. Yeah.
So could someone come to you guys instead of just going to the dentist and like, or does it have to be like I go to the dentist and then I come to you type of thing?
That's a great question. Like, so right now, like we are offering only through the dentist, and
Okay.
it's not like at-home testing kit, but in future, like we are
Okay.
we are planning to do that as well. Like, just like offering at-home testing kit or like sample collection kit, for example. Yeah. So if somebody wants to test, they can simply collect saliva sample at their home and then send it back to us. But we are not there still, so
Okay.
we'll do
That
that.
makes a lot of sense because I was like, we were talking and I was like, I didn't even like think about asking that question, but like I liked what you were talking about, so I was just like, yeah, I just want to hear what he has to say at first.
Because one of the things is like, so now it's like the business, whatever business you do, like it's more,
Mm.
I mean, it's a time like where you use mostly the internet, like so online, like so one of the things we can do is like we provide the online service, dental services. The clinicians, I mean, they can talk, they can taste, and they can talk with like dentists online, like and then
Oh,
the
nice.
dentist can recommend like what to do next,
I
because
like that.
as a lab we cannot recommend them anything directly, like so the patients,
Right. That makes sense.
that needs
Yeah.
to come from the doctors, like yeah.
Yeah. That's really cool. Okay, so let's actually kind of set the tone for our viewers and listeners. When you look at your role as CEO and also the chief scientist or scientific officer, what uh sorry, my brain is not working today. Oh my gosh. Could you just tell us a little bit about those two roles? Like, and do they like ever like, I guess like, I'm not trying to say like interfere with each other because I'm like, it's still the same like job, like within the same company. But I'm like, do you ever feel like you don't have enough time to do one of those things or something?
That's a great question. Like, so, like as a startup company, like you will have like multiple roles in the same company.
Yeah.
And then as a background with like science background myself, like, and then expertise in like this field, molecular biology field, like, I don't, I mean, it's very easy for me to take a role as a chief scientific officer, but on the other side, like CEO, as a CEO, like, so I'm learning a lot. So,
I like
so
that.
the good thing is like when you have a startup company, like you are learning and doing work and learning a lot. Like I have a lot of motivation, and then I have a good faith. Like I can do it. And then
Yeah.
yes, yeah, you were right. Like so as a I mean having a roles, both roles at the same time, it is very 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 hectic, but
Yeah.
it's fun as well. Most
Is
important
it,
thing is like you should have fun, like working anything. Like when you have fun, like you can do it.
yeah. Is it like time consuming for you since you have to play like you have to wear like two hats in the business at the moment?
It's time consuming, but the only thing is like how you manage your time. That's the more key thing, So
Yeah. Yeah.
most importantly, I have a plan. I mean, every time when I do something, like I have a concrete plan, like I have in my calendar, like what I need to do and what I will do in next 30 days, for example. That's
I
how.
like that. I like how you're so like you sound very prepared. I'm like I need you in my life to help me stay like prepared and like knowing everything I need to do.
Yeah, yeah.
I'm like
So
my iPhone does not help at all, not at all.
So one of the things is like now I have little hard time, like because you are saying like well, I'm in two roles, but in the meantime like I'm working hard in marketing role as in the business marketing field, I'm thinking like what we are doing now right now is like business to business connections, like marketing, not like hiring a lot of marketing team as a
Hmm.
startup company, and then also like one of the ways to reduce the cost of our uh, I mean testing panel or anything is like so hiring less number of marketing people, and then like directly going to business, so I mean we are connecting to different dental clinics directly, like onboarding them, and then uh,
Yeah. Do you guys go like to them like in person or do you just like kind of call them or do like a Zoom call type of thing?
that's a good question. Yeah, we try to call. Sometimes they don't listen us.
Of
Yeah,
course.
it's happening that way. Like, but when I call like 100 clinics or like 50 clinics, if five clinics receives the phone call and then they are onboarded, that's enough for me.
That's so funny. Because it's like some people they're just like whatever, like I don't need it, blah blah blah. But it's like if you
Exactly.
actually were to sit down and talk with a person, it's like you would realize you
Yes.
probably do need this.
Yeah. 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 That's true. That's true. Yeah.
Oh goodness. Okay, sorry, I'm just trying to write this down real quick. Um, what is one thing that you wish that more people knew about your business?
So one of the thing I wish is like they should know more thing about like why the oral hygiene is very very important, you know. And then by knowing that, so they should visit the dental practice regularly and then use our testing panels for testing their gums.
Yeah, because it's like you what we were just talking about. Like there's good and bad bacteria in your mouth,
Exactly.
and it's like you could like you can make the bad ones really just come out by not taking care of your teeth and your gums.
That's true. That's true.
Yeah, and it's, oh my gosh, I know someone. I think I'm pretty sure he has like gum disease because he never brushes his teeth. But there was one time I saw him brush his teeth, and it was like bleeding, you know.
Yeah, yeah.
And I was like, oh, that's not a good sign, sir. Like, you should definitely go to the dentist or
Yeah, the
something. But
problem is that people
he's
people
just
ignore. Yeah,
someone
people
that doesn't
ignore.
take care of his hygiene at all. So I was just
Yeah.
like, okay.
Yeah, the problem is like people ignore dental hygiene so much. It's like when you have like let's say like you have a scratch in your skin, you immediately go to doctor or like you apply some antibiotics, you treat that
Hmm.
one because you have in your you can see that scratch and you have like so many things like that infection might happen if you don't treat that skin scratches like probably you might have like that infection might go to bone, yeah.
Yeah.
But thing is, like in when you have such kind of things happening in your mouth, you don't care unless and until like that infection goes to your teeth. That's how the bone loss is happening, you know. That's the problem. Yeah,
Right. People don't care until they get that pain in their tooth and they're like, oh,
exactly,
like,
exactly, exactly. Most
oh,
important thing is the education, like you know. So you have to, the people needs to be educated, like you know.
yes.
That's a challenge, like you know.
Yeah. So we're actually going to talk about a little bit of marketing because you kind of said that you do a little bit of the marketing for the company. And I think it's vital for every company to do it because otherwise no one will really know about you. But I'm always curious what successful businesses are doing. So do you know what percentage of your monthly sales is typically invested back into your marketing budget?
That so one of the things like you know like we launched our product like probably I don't know whether you know or not like it's just like in December last year we launched our products
Okay.
from December last year. Those are the probiotics, and then like for the dental panel we launched this month. So
Oh, okay.
so it's very new.
Yeah.
So one of the things we wanted to really wanted to do is like spread out like we exist, you know, that's important.
Yes.
That's why like I've been like using LinkedIn, Facebook, all the social medias, you know, like to tell the people about like our company, and then and now you are here. Like I'm very happy
Yes.
that I get this opportunity as well. Like you know, uh,
Yes, and of course, like we're in the Austin area, so hopefully a
exactly,
lot of the Austin people will see this and be like, "Oh
exactly,
yeah, like we need
yeah.
that."
And then one of the things I really thinking about is like, you know, so have some partners, if possible, who are expert in marketing and they can have their input or like contribution in our business. You know, I'm just looking for the right partner. Let's see what happens. Like, and then like they
Yeah,
can see on the business marketing side of the business, like, you know. Yeah, I'm looking for those kind of those people. Like you know, let's see when I find the right person. Like you know.
yeah. And then also earlier you had mentioned a few team members here and there where you need them as possible. Um, how would you describe your leadership style in business, and has it changed over the past couple of years?
So you yeah, that's a yeah. So we have two people like who I mean founding directors to other founding directors. You know,
Okay.
thing is like they are very busy in their business. Like you know, and then well, most importantly, I mean I'm doing. I'm looking after like this business and I'm giving 100% of my time. Yeah. So
Yeah.
I know like your question was like how my leadership is impacting my business or
It, has your leadership style changed like in the
okay.
past couple of years, or how would you even like describe your leadership style?
Okay. Yeah, yeah. Yeah, that's good. That's good question. Like, you know, yeah, my leadership style is like, you know, so I wanted to have a certain task, you know, and then whether I mean whatever whenever my employee I distribute those tasks and how they complete that task, it's up to them. So only thing is like
Right.
that should be the results should be there. Whether they stay at home for like 5 days not working or like you know I don't care about that one. Like at the final end, there should be a result. Like, you know, uh, the problem with many businesses is like they ask their employee working for like 12 hours or like 14 hours or like 15 hours. But they
Mm-hmm.
say like, okay, I work so hard, but if result is not there, what is, I mean, the benefit of working so hard, like, you know? So
Mm-hmm.
most important thing is like there should be output. When you give some input, there should be output. If there is no output, and then you work hard, that does not mean anything, like, you know? So yeah, it's a teamwork at the end, like you know. So I believe like in teamwork, like and then Weber is partner. They should have a contribution in their business. That's what I feel, and then that's true as well, like you know. And then yeah,
I like that. Yeah. Okay. So let's move on, or let's move forward and look at what's to come next. So where do you see your business in the next 3 to 5 years?
That's a good question. Yeah, there are so many my targets. There are so many targets. Yeah. So one of the things I was talking about, like we have a dental periodontal panel. Yeah, that's a
Hmm.
for phase one products
Yeah.
that two probiotics and prebiotics product, dental probiotics and gut probiotics and a dental panel. That's the first phase. Second phase we have in next year. By next year, we wanted to have point of care diagnostic device development in next 2 years. Like, that meaning that like we wanted to offer point of care diagnostic devices to dental offices. Not like we
Oh,
don't want to have a sample from dental office to here. What if we have developed a point of care diagnostic device that can detect and quantify these five pathogens in their office within 30 minutes, for example? Yeah. So we are
yeah.
working on that as well. And then
That's
in the
cool.
next 5 years, not only we want to focus in like this dental area, but in other areas. Like as I was telling you, like before, in the
Yeah.
there are so many analytes as you wanted to think of, you can think of, like, I mean, you can detect like for the cancer, oral cancer, or like, even
That would be so awesome. I'm
exactly,
like,
exactly,
you just like blew
exactly.
my mind. I was like, ah, cancer.
Exactly. So we wanted to go in vast areas of like health, like, not
Yeah.
only health, but other areas as well, like, So
That's
let's see, like,
cool.
I mean, I hope like in the next 5 years, we'll be expert, salivary expert, like, So we wanted to be salivary expert, and then yeah, we wanted to develop different panels and then have business more flourish, and then I've
Yeah.
and also like we have already our brand, like unique Biosciences brand. If you type in Amazon, like, so our two products will appear, like, we have unique by if you type unique Biosciences, our two products, oral products, and then also like gut products are coming, and then we wanted to also expand that probiotics field, like to veterinary area, like for oral probiotics for dogs, cats, there's
Oh, that's awesome. Because I
so,
like dogs, like, and oh my gosh, I was like, I didn't realize like how bad dogs' teeth could get as well until I worked at a vet clinic, and I
yeah,
was like, yo, and then that's even expensive. Like, it's more expensive than my mouth.
yeah, yeah,
Oh my gosh, yeah, it's crazy. The things that you don't even think about until it happens, or at
yeah.
least like it happens to someone else, and then you're like, I've never
Mhm.
even thought of that. Like, that's
Exactly.
wild. Well, that's so cool. I would love to see those for like animals. I'm sure a lot of other animal lovers and owners would love to see that too.
Exactly.
So
Exactly.
yeah,
Yeah.
especially being here in like in this area, like there's so many people with dogs like
Yeah.
everywhere here in Austin. I'm like, it's like you don't go like half a mile without seeing someone walking their dog.
That's true. That's true. Yeah. Yeah.
Well, you have had a really interesting story, Pravin. As we wrap up, I do have a few rapid fire questions for you. Are you ready?
Yeah, sure.
Okay. What is the key to success for you?
I mean, hard work. And then like you have to be patient for anything you do. Like, patience is most important. Like, and then yeah.
I like that answer. What is one piece of advice that you have for other business owners?
Yeah, so I mean, try to be different from others. Like, so don't jump in any project which is very similar to other businesses. Like, other project, it's what people are doing. I try to be different. Like, try
Yeah,
to be unique. That's how our unique biases came from. Like, we wanted to be unique. Like, yeah.
yeah. It's like you didn't want to
And
be like anyone else. You want to be one of one.
exactly, exactly. And then like if you are doing some business and you have to see, like, and then one of the things we wanted to do is like we are filling the gaps what existing big businesses are not doing. Like, that's
Yeah,
how I said, like, every time I was saying like complete package, So
yeah. I love that. What is or do you have a book or a podcast that you are reading or listening to right now?
not. So
It's okay.
I want to
You're not the only person. Sometimes people just get too busy and they don't have time. So I totally
exactly,
understand.
exactly.
And then this one, it's a kind of a fun question. If you had a little bit of magic dust and you could choose one spot in your business to sprinkle it, where would that be?
I sprinkle in for marketing.
Right. It's like, let's get that marketing up. And let's make it easy. I'm like, why does marketing have to be so hard sometimes?
Exactly. Yeah. Yeah. But anyway, like it's just beginning for our business, but still, like I want to sprinkle in marketing field.
Right. So before we get to the final question of the day, could you please share with our audience how they can follow you, learn more, and contact you?
Okay, so we have our website. Like you can type like www.uniquebiosciences.com, and if you wanted to contact me, it's my first name Pravin, Pravin at uniquebiosciences.com.
Okay, well, we've come to the final question of the day, and that is, what is most inspiring to you today?
Okay. So I mean, seeing clinicians use our tools to change patients' outcome to prevention rather than reaction, So that's a sort kind of thing, like, yeah.
I love that. Well, this has been a great conversation. I've really enjoyed your story, so thank you for sharing it. And then
Thank you so
also,
much.
yes, thank you so much. And also, I want to encourage all of you who are watching to save the show and come back later because Simon really did have some great insights for business. And also, please don't forget to like and subscribe so that you can get notifications every time a new conversation drops, just like this one. Thank you to everyone who joined us today, and a special thank you to you, Pravin, for being here with us today. We really do appreciate it.
Thank you so much. Thank you for having me here. And then talk about like our business and then, all of this conversation. Great.
Yeah.
Thank you so much.